Welcome back to Arthritis Now. Today we're going to be finishing up our interview with Dr. McAdams-Demarco on all of our research on gout at Johns Hopkins. If you missed part one, make sure to check it out here. If not, sit back and relax, and let's jump right in. You've been the first grantee to be collaboratively funded by ANRF and AFAR, like you said. Well, what did it mean to kind of receive that grant for you?
It was really quite an honor. Public health and research just works better through collaborations, and to see funders collaborate like this was very exciting for us. The grant really has allowed me to focus my research on a specific and highly vulnerable population, those older adults who develop gout. This helped me to better understand the impact of chronic conditions in older adults and how they lead to the development of gout. To me, it's been important because we often study younger adults and then just broadly apply the findings to older adults. And we have to recognize that not necessarily everything we understand about the development of this condition in younger adults really applies to older adults. So, for example, we found that there is a strong genetic risk factor, and that may be, in fact, stronger for the development of gout in middle age. But as you age, the genetic risk may diminish, and in fact, other non-genetic risk factors may play a more important role. And these are findings that would only have been identified by studying older adults specifically, and not just looking at everybody lumped together.
How has being funded by two different institutions kind of allowed you to research arthritis on two different kind of fronts?
Well, this has been a perfect opportunity for me. It allowed me to combine two of my interests, namely the epidemiology of gout along with the epidemiology of aging. Specifically, with this grant, we were able to borrow the tools from gerontology and apply them to the kind of nascent field of the epidemiology of gout. So for an example of this, we borrowed the tool of the short physical performance battery, which was developed in community dwelling older adults. And we used this series of tests of lower extremity function to better understand physical function in older adults with gout. Again, this is the type of research that really works best when you're able to pull tools from one area and apply them to a new understudied research area like gout epidemiology.
And how is the scope of your research, or what you were funded by ANRF not too long ago, I know, but has the research or the scope of your research changed since you've been funded, or has it led to any new prospects?
So just as you were saying, we started by just focusing on chronic conditions and looking at them as risk factors for the development of gout in older adults. But then we kind of expanded in both directions, both to the cellular level and looking at genetic risk factors, into the more macro level of looking at socioeconomic status, or kind of an upstream risk factor for gout. And we talked about the socioeconomic status a little bit before, but we were able to then dive into kind of developing a more complete picture of the risk factors for gout. And studying each of these in isolation ends up kind of limiting your ability to really help the older adult who's at risk for gout.
So where do you see your research heading in the future? Like 5 years down the line, kind of where do you hope it could go?
Through this grant, we've been able to add more knowledge to the field about risk factors for gout, especially in older adults. But that's kind of only the first piece of the puzzle. The next piece is really, what do we do with that information? How do we take all the information that we've generated about risk factors for gout, combine that with a lot of other really stellar work from the field, and build a tool for clinicians to help use to identify high-risk patients? So we would hope to be able to build a tool so that the clinician can predict which of their patients are at risk of developing gout as they age. If you can combine a person's genetic risk and their non-genetic risk, can we then correctly identify who's going to be likely to develop gout as they get older? And this ends up being very important because it gives us a way to both prevent the development of gout through modifiable risk factors, or at least reduce the risk of developing gout. So if we know that it's primarily a person's non-genetic risk factors, can we use that to then modify a patient's risk? So an example would be if a physician knows ahead of time that their patient is likely to develop gout in, say, 5 years with a 60% probability, could they address modifiable risk factors? So could they, for instance, use a different type of antihypertensive instead of a diuretic? And would that then consequentially lead to a lower burden of gout for this patient, or at least delay the onset of gout for them?
Perfect. Great. Well, I think that's pretty much all that we have. Is there anything else that you would like to add at all?
No, we just want to express our gratitude for this grant. It was really a great opportunity for us, and we appreciate the focus on older adults. That's really, it's really a vulnerable population that's going to be growing in numbers within the next 10, 15, 20 years. So anything we can do now to better understand chronic conditions, especially gout in this population, is really important. So again, thank you for our opportunity to do this work.
No problem. Thank you for everything that you're doing as well. We appreciate it. Thanks for watching our interview with Dr. McAdams-Demarco. Make sure to subscribe to our YouTube channel, check us out at curearthritis.org for all the latest info on the foundation, and don't forget to share this video on Facebook and Twitter to help raise arthritis awareness.